Well, today, November 14th, is World Diabetes Day. And according to the Centers for Disease Control, more than a third of Americans actually have prediabetes, but 81% of those don't even know it. Joining us now with more on the disease as well as tips to prevent it is Dr. Renee Dua. I want to welcome you. Thanks so much for joining us. So let's talk a little bit. It seems like there's so much talk about diabetes, not just today, but all the time. Why is diabetes becoming so common here in the U.S.?
And so these days are great because they bring attention to what we don't know and we need to know. We are spending more time scrolling, we are spending more time streaming, and we are not exercising. We are spending more time eating processed foods, and we are not eating fruits and vegetables. And so diabetes is a now common condition in America.
And let's talk a little bit about, we mentioned how many people had pre-diabetes versus diabetes. Can we talk a little bit about what the difference is?
Sure. So pre-diabetes means that certain lab values are elevated, though you're not per se diabetic yet, and you might not have symptoms of diabetes. Symptoms of outright diabetes might be that you're very thirsty, drinking a lot of water, you're peeing a lot, you feel sluggish and tired. You might have vision changes, but before you become an outright diabetic, you might be overweight. Your lab values might show that you are about to become diabetic.
But you can prevent that?
Yes, you can.
So what can we do at home to prevent or manage it if you've already been diagnosed?
And so, again, maybe while you're scrolling and streaming, get up and walk. Put a treadmill in front of the TV. Even better, go outside and take a walk. Eating food that's not so processed, If you have to find food in a box or a can, it would be
Can you give us an idea? We said that so many people don't know that they're pre-diabetic. What are some of the signs that we really should be looking out for right now?
And so again, if you notice that your mouth is always dry, you're constantly thirsty, you're peeing a lot, you're running to the bathroom more than once an hour, if you notice that you feel sluggish, you might be losing a lot of weight. And that happens when insulin in your body is not being produced or is not working correctly. Those would be signs you would look for to see if you're actually suffering from diabetes.
And I know that you've been working on an app that can help people. Tell me about that.
I appreciate that. I am the founder of an app called Together, togetherapp.com. And the exact premise of Together is to turn your smartphone into your personal health assistant. The idea is that you scan a picture of your insulin bottle or your metformin. The app will build your health profile and then remind you to take your medications, get your refills. We can even check your vitals with the camera on your smartphone. So it's a great way to keep on top of your health tasks.
Now, we've been seeing a lot of commercials about diabetes medications that are also helping people lose a lot of weight. And it seems like a lot of people are getting on these drugs that might not have diabetes, but that want to lose weight. So what can you tell us about that? Is that a good idea, bad idea?
There are drugs that are marketed to just help you lose weight, and you don't have to be diabetic. And that is not an off-label use for those drugs, so it's perfectly acceptable. And people should use them, and people should have access to them. And then there are drugs that help you lose weight, in addition to help deal with and manage your diabetes better. To give you an example, I was with a patient, a beautiful woman yesterday, who was overweight with diabetes. I started her on a medication that has helped her lose weight, and her diabetic control is improving. Her blood pressure is improving. Her cholesterol has improved. So I'm very excited about how these types of medications will help us, and you, I'm sure, have read the studies. Heart disease is disappearing, kidney disease is disappearing thanks to these drugs. Very exciting time for obesity as a chronic disease problem.
All right, well, doctor, thank you so much for joining us. We certainly appreciate it. And for more information on Dr. Dua and the health app she's created, check out our website, kcalnews.com, and click Seen on TV.